I'm going to start with a short vignette ethnographic vignette from my fieldwork. So I hope it doesn't work as a nap tale and you fall asleep. Oops. Okay, good. So, I'm in a waiting room with a Romi in a public hospital in Madrid. She was going to have a pregnancy ultrasound scan, and when we got into the consulting room, the gynecologist, a woman in her 50s, kept on looking at the computer screen when we came in. Only the nursing assistant standing next to the gynecologist looked at us and invited us to sit down. The gynecologist was still staring at the clinical records on the screen, and she asked Alba, the Romney girl I was with, the reason why the previous delivery had been a C-section. Alba did not know the answer, and she looked at me as though she were looking for help to answer the question. But I did not have time to reply because the gynecologist replied herself. Oof, at that age, it could have been for anything. The nursing assistant, Alba, and I looked at each other with expectation about what was going to follow, acknowledging the weirdness of the situation where the leading voice seemed to be in a different place, not looking at us and just looking at the screen computer. The gynecologist asked Alba why she had not sought prenatal care earlier in her pregnancy. Alba, looking at the gynecologist, who was still looking at the screen, did not reply and looked back at me as if seeking help again. After some seconds of uncomfortable silence, I translated the question for Alba as, had she gone to the doctor to see the baby before? Alba replied no, even though she had previously done blood tests and has been in another healthcare service for the pregnancy follow-up. The gynecologist scolded her about how important prenatal care was from the beginning of a pregnancy. After that, the gynecologist told Alba that she should stop having children after this pregnancy. The antecedent of a C-section or any other medical condition was not mentioned to back up her statement. Instead, she kept on asking Alba, "Do you have a job? And your husband?" Alba replied promptly, finally one question to which she knew the answer, that she did not have a job and nor did her husband. But she told the gynecologist that they were living with her mother and father-in-law and that they provided for the young couple. Still trapped by the clinical records on the screen, the gynecologist frowned upon Alba's answer and lectured her about the need to be independent from the grandparents of the baby. And she stated that she should look for a living to be able to raise her children. She finished her speech by finally moving her gaze from the computer and looking at me, she said, "But you know, these cultural traits are, let's say, very peculiar." So with this extract from my fieldwork, I wanted to illustrate the object of analysis of this paper that is part of my PhD research, and is to see how healthcare is provided to Roma migrants in Spanish public healthcare. And in this paper, I explore how healthcare workers construct or discursively construct a representation of Romani migrant patients. And this representation has a specific temporality and location which shape the particular modes of clinical subjectivity. For this research, I have been doing fieldwork for 12 months in different healthcare centers in Madrid, especially in two primary healthcare clinics, one in the center, in the city center, and another one in the periphery of the city. And also, I'm myself a general practitioner, and I have been working for 10 years in one neighborhood. So, I mean, the fieldwork, most of the data, they come from the fieldwork, but also I have like this background that actually prompted the research. So, to do this research, I follow some authors, such as 14, and I consider the clinic as a social space in which a set of social, cultural, structural, and asymmetrical relations are played out, and also where alliances are negotiated. As in the previous vignette, my aim is to investigate the notion of culture as it is held by clinicians and by healthcare institutions. And I want to discuss this notion of culture by resituating it within the framework where it is used, or where it comes into play. For example, like this one. And so my argument is that institutional logics, working conditions, and resources contribute to the creation of this representation of the Roma migrant patient, as much as the social imaginary about Roma, but in this case about Spanish Gitanos too. Thus, in the clinic, we can observe different repertoires of practice in relation with the provision of care to Roma. And I use Janet Paul's definition of repertoires as this kind of specific actions, ideals, and knowledge forming modes of ordering, right? So there are, let's start with the repertoires of practice that are more related to healthcare and the institution. And so there are like some, biomedicine as a kind of knowledge, creates knowledge and creates some categories to locate people. And so in this context, we can see that they are not especially sensible to categories of ethnicity. And here, for example, this is one of the questionnaires that you have to fill up if you are pregnant and you want to have like the risk test, right? And so when you read race, then you can feel is white, yellow, or black, and those are like the categories where you can. So this gives a little bit an idea of like the general context and how these topics are considered. And then as well, other thing that I think is interesting for this case and to see how like the Roma patient became like this kind of new version of of the old Gitanos is like the clinical temporal framework that is marked by biomedicine. And so, there are like different ways in which biomedicine understands temporality. One of them is like disease is perceived as a kind of interruption of the progress of normal life. So most of the actions that doctors, nurses have to do is just to try to stop this natural course of disease. So you have to foresee what is going to happen, and then you can avoid it. So it's always about planning and also about this idea of the present future that is always like putting like the future in the present so you can avoid that future to come, right? So there is always like this kind of temporality, and also that has to do with notions of risk and ideas about prevention and how you have to deal with your body and how you have to take care of yourself. And then there is also an institutional framework that it's quite, sometimes it constrains and other times it allows, but the thing is that this framework also creates like different types of citizens. And as you see, in the previous, in the picture from the beginning, this is like one of the waiting rooms at one of the centers from gynecologists, and if you see that it was kind of a very contested space while I was doing my research, because there were like two laws that were quite important. The first one was one that was limiting healthcare to just people who were insured. So we were passing from a system that was based on universal coverage, so everybody, at least they were considered to be able to access healthcare. There were other barriers, but it was like, okay, healthcare is for everybody. But then they changed it in 2012, and now has been like kind of a little bit reverted, but still creating like different categories. So they changed it, and now if you are not insurance, it means that if you are not working or if you are not claiming like benefits, then you can't access healthcare, right? So they were making like more barriers to access healthcare. So that was one that it's important to bear in mind, to understand like how to create these different categories and different kinds of legitimate citizens. And the other one was that there were, in 2010, the regional government, because, well, one important thing is that primary healthcare in Spain is not like in the UK or in France, that it's like a private practice, it's public practice. So really the people who work in primary healthcare, they are like frontline workers, and they are employed by the regional government. So they tried to privatize that, and then to put like to sell the to put like private business to deal with that. And then there were a huge contestation, and it was during the worst years of the crisis. So there were like this contestation that was called the White Tide, Marea Blanca, and it was because everybody was wearing like the white coats. And it was really like, it came to represent like how people can gather together and can oppose the budgetary cuts and also like the austerity measures that the government was implementing. So at that moment, it's quite interesting because it really became like a kind of hope for a lot of people, because actually they stopped the privatization process, and then they sued the regional government, and on trial they get to stop it. So it was really very interesting, like this difference, because actually, the privatization was stopped, and the White Tide became like this kind of very important in the public sphere movement, and just people going together and being able to defend like a public service. But then on the other side, primary healthcare has been underfunded for a long time, and then now with the budgetary cuts, it's more underfunded, right? And so this is like it's very interesting, because the people who are, the workers who work in the primary healthcare centers, they were like very active in the demonstrations, but then in their work, they really have to deal with a huge workload. That the conditions are much worse, right? So, and then so this is more like the cultural, or like the categories of practice at the healthcare center, and then we have the cultural repertoires about Gitanos in Spanish society. And so this was a leaflet that I found while I was doing field work, and it was, so it's this Caritas, that is this NGO, Catholic NGO, and they have like this wardrobe service, so they make this distinction in between, you can go if you are people in general, you can go on Tuesday, and then if you are a gypsy, you go on Thursday. So it's like there are people and then there are gypsies, right? And so what was very striking for me while I was doing field work was that I found, what Banvar calls the reasonable anti-gypsyism. So I saw like in the public, when we were having like discussion groups, everybody, the commonsensical thing was to say that gypsies were a problem. And when they were talking about Gitanos, they were talking about Gitanos and Roma. Then there were like differences afterwards. But this commonsensical thing that, okay, if we are talking about Gitanos, we are talking about problems. And I can tell you that we deal very well with this problem or not, but that was and then in the interviews, people was making more nuanced comments, like not really, and then the practices was a little bit different, and then you can see a much bigger array of difference, and that's quite interesting, because then you also see like this, when Gitanos and Roma are very visible, and when they are more invisible, and the difference that this creates. So there is like that leaflet, but then there also there is like the survey of the Sociological Institute about discrimination, and this is 2013. But what it's interesting, is like half of the population would have concerns about having Gitano neighbors, right? And this is you say, it's better than in other countries in Europe, right? Because, Spain, we are the example to follow, blah, blah, blah. But actually, Gitanos, they are still the group that people have more concerns to live among, right? I mean, the next one were like people from Muslim background, and it was like 40%. So it's still, they are like people have more concerns. And so, and Lopez and Catalan and Said, they made like this very interesting research in healthcare in Catalonia with Romanian Roma, and access to healthcare, and they talk about this double stereotype that I think we have been talking a lot about it. That is like how visible they are in the in the media, and also in the public sphere. This Roma with a very negative visibility, but then how we don't know anything about them. So most of the representations about Roma, they come from this negative visibility that they have in the public space. And then another thing that it's interesting, well, is that Romanian migration in Spain, it has a kind of positive connotation. And Romanian, I mean, different studies have found that Romanian migrants, they were like appreciated for Spanish, mostly because they were working. I mean, before the crisis, they were working in all these construction sites, and good workers, willing to integrate, not looking different from a Spanish average person. But then what the difference comes when you get the ethnic category, and then when you put the Roma, then all the positive thing of the national category just goes away. And Jenny did some research in the schools in Catalonia as well, and he was finding that. So this is one of the healthcare centers, the neighborhood where one of the healthcare centers is, and and so it's one of these places that was really hit by the crisis, because I mean, in Spain we were building crazy, and suddenly it stopped, and a lot of people got unemployed, and a lot of houses were empty, whereas other people was, So it happens that okay, so maybe I read. Okay, sorry. So one of the primary healthcare centers were attending like the people from this neighborhood, but they also were attending the people from this settlement that was next to this new urban planning and this neighborhood. And I like this picture because it's like putting everything together. And what is interesting in this construction of Roma as this kind of new version of the old patient that were the Gitanos is because there were the Roma population in this neighborhood. Not all the Roma in Madrid live in substandard housing, but this healthcare center, they were attending to this, but the population living in this settlement that is also located next to one of the only settlements that are in the outskirts of Madrid now, because there were like this council plan to eradicate like all the settlements. So everybody, when they didn't get relocated in houses, so they moved to this one. So now it's like this huge settlement next to the dump site, and then next to that there is like this small Roma settlement, right? So the idea that the arrival of migrant Romans from Eastern Europe and their settlement on the outskirts of the city in handmade shacks in the very same areas that Gitanos have historically occupied has reinvigorated the idea that nomadism and self-isolation from the non-Roma as well as living in precarious conditions is something intrinsic to Roma and Gitano culture, and therefore something that confirms that Roma and Gitano are intrinsically the same, but in different development stages. So substandard housing, Gitano culture, and ideas about progress intertwine to create a representation of Gitano and Roma as people in need of development programs. Gitanos and Roma are re-educable, but at the same time, they are perceived as a lost cause, because they continue living in informal settlements in marginal areas of the city. So it is as if the rest of the Spaniards had embraced European modernity during the years of transition to democracy at the end of the 70s, and Gitanos had remained unchanged with the backward culture. Because, I mean, after the Civil War, there were a lot of movement, not only of Gitanos, but of Spanish population to the to Madrid or to the big cities, and they were like living in shacks as well, right? So some people managed to get houses, and other people not. And among them, there were the Gitanos too. But then, eventually, it was mostly the Gitano population that remained in these kind of shack settlements. So, yeah. So, and also this has like, in a way, like the housing problem has been culturalized as a Gitano problem, as other authors like Belushi, Faveni, and the people from Granada have shown. And it has been due to the combination of the institutional racism of the Francoist regime and the difficulties of complying with all of the administrative requirements that were asked to get relocation. So, So, yeah, so the healthcare workers, they talk about the Roma in a way that, I mean, okay, I go to the, yeah, like all these topics, like the housing and then living in the same place as Gitanos used to live, and still some of them live because they are lost cause. These topics intermingle to create this image of a Romanian Roma migrant that it's different from the other Romanian migrants, while drawing like the similarities with the Spanish Gitanos and reinforcing the idea of a shared Roma culture that is reified and generates this, and it's this culture that generates the social exclusion of both Roma and Gitanos. Thus, in the narrative of the healthcare workers, Roma culture produced multiple deficiencies, such as living in substandard housing, not following the established healthcare rules, and the reluctancy to do so. And this is quite similar. I mean, this is not a specific of Roma. I mean, other people has also find it for other ethnicized groups. For example, Charles Briggs and Clara Martini, they found the same in some groups in Venezuela. But then we can consider Romans and Gitanos as unsanitary citizens. So people who are judged to be incapable of adopting this modern relationship to the body, hygiene, illness, and healing. But nevertheless, in their narratives, healthcare professionals admit that due to the different intervention programs and institutional help, Spanish Gitanos have ameliorated their living conditions and enabled some Gitanos to possess medical modern understandings of their bodies and the disease processes, then becoming closer to be sanitary citizens. It's in this way of reasoning that the new migrant Romans represent a new version of this old patient. Either those Gitanos who live in the marginal settlements in the 70s and 80s, who afterwards were relocated and improved their living conditions, or those Gitanos that, in spite of the inclusion programs, still live as unsanitary citizens in the settlement. Okay, I'll leave it there.